survivor-centered holistic response to CRSV and the practical guide on the survivor-centered approach. I just want to flag that we will be recording this session as we want to be able to share it also with participants and people that are interested that are not able to join us today. Good morning, everyone, and very much welcome. 10 years ago, the Mukwege Foundation was created on a strong conviction, and we made a strong commitment to stand alongside survivors of conflict-related sexual violence, not just in bearing witness to their pain, but in building the systems, the knowledge, the practice that truly puts them at the center of every response. And today we mark that decade with something that we're really proud of and are very happy to share with you today. The launch of 2 resources that represent the best of what we've learned together with survivors, practitioners, and partners across the world. The digital course on survivor-centered holistic response to conflict-related sexual violence, and the practical guide on the survivor-centered approach. We know that by now survivor-centered approaches are widely recognized as essential, and yet their consistent application in practice remains one of the greatest collective challenges. Good intentions are no longer good enough. And translating these principles into day-to-day work requires time, commitment, and practical guidance that is grounded in real experience. And that's exactly what we hope these resources will offer. The digital course was co-created with 𝗦𝘂𝗿𝗃𝗶 UK and shaped by the lived experience of survivors, particularly through 𝗧𝗵𝗲 Ukraine. It's now available in 4 languages, with Arabic coming soon, and it's designed to be accessible to anyone working with or for survivors, from frontline care providers to policymakers. Our colleague 𝗬𝗵𝗲 𝗗𝗶𝗴𝗶 will walk you through its development, objectives, and practical use. And we will first hear from Julia ሊκα, head of the High School of Public Governance in Ukraine, who will share her experience and insights as a professional who has worked with this training firsthand. The practical guide will draw on a decade of field experience and was developed in close collaboration with survivor networks, including 𝗧𝗵𝗲, the global network. It's a guide built not just for practitioners, but with survivors. Jacqueline Matira, a 𝗧𝗵𝗲 member from Kenya, will reflect on what it truly means to translate survivor-centered principles into practice. And Annemarie de Brouwer will then present the methodology behind the guide's development, followed by Appeline Pearson, our colleague, who will walk us through its key components, rationale, and practical application. I'm grateful to each of them for being here and for the experience and expertise they bring to this conversation. Our work is far from over, but today we take an important step towards ensuring the survivor-centered principles are not just aspirational, but they are actionable. Welcome, and thank you for being here. Next slide, Lucy. And now, very welcome, Julia. Very happy you're here. And can you please share with us your experience in working with the course? Over to you, Julia.
Yes, thank you, dear colleagues. I am glad to see you. Thank you, Catherine, for the cooperation, a long-term cooperation with high school signature and memorandum for cooperation. And now we developing a professional capacity of civil servants and local self-government in the field of preventing and responsible to conflict-related sexual violence. In order to ensure a high quality education process, the high school has formed a pool of trainers have a natural experience to conducting trainings of the relevant topics. One of the important areas of work has been a training on interaction of the fields of the conflict relation sexual violence. This contributes to strengthening coordination between state authorities and other institutions involved in responsible to conflict relation sexual violence. The high school is area of the relevant of these topics, taking into account modern challenge and potential for future development of training programs and explaining the audience. We express our gratitude to the Fond Mukwege for developing and provide on the online courses. And these courses very important for developing the education public servants and other employees, and high quality education content. During 20-25 years, the high school provide training to about more 9,000 involved in the system of prevention and combating conflict relation sexual violence. In the partnership with the Mukwege Fund, the high school organized and conduct training for trainers and training for representative of regional department, the National Social Service, Ukraine, and this year's high school conducting the systematic work in this area, and now we have 140 employees. And civil service and local self-governments have already completing training of the topic of these spheres. In the future, high school will plan to explain training opportunities, improve education program, and loan and cooperation with national and international partners and Ukrainian and international institutions in the field the prevention and responsibility to 𝗏𝗵𝗃. Thank you for cooperation. Thank you for support Ukraine and support training cooperation with high school.
Thank you very much, Julia, for your words, and I think it's very good, and we're very happy to hear that the course actually it's serving its purpose already in Ukraine, where you and your colleagues are using the course to train people, and including trainers of trainers, to be able to further roll out the course. So thanks a lot, Julia, not only for the training, but also for the ongoing collaboration.
Yes, thank you very much. We already a long cooperation, and we already start to new works this year.
Okay, thanks.
Thank you.
Look forward, Julia. And now I want to invite 𝗬𝗵𝗍 𝗍𝗶𝗴𝗶. She's the Mukwege Foundation Director of Care and Country Programs, and she's very much been behind the initiative and the development of the course, and she will share with us a bit more of its content. Dominique, over to you.
Thanks. Thanks, Katrien. Do you hear me? All okay? Yes, great. No, and thank you also, Julia, for sharing the digital courses on survivor-centered and holistic response to conflict-related sexual violence. And we've initially developed the course out of a specific request that came to us in the context of Ukraine, where Ukrainian state partners in 2022 highlighted to the Mukwege Foundation that they felt the need to really strengthen holistic and survivor-centered response to conflict-related sexual violence at all levels. And part of that was ensuring that there would be standard and comprehensive training for all types of professionals working on this topic. That was in 2022, and in 2023, we launched the process of co-designing this course together with Ukrainian and international technical experts, professionals, survivors, as part of a joint technical committee. The course went through several series of reviews, including by Ukrainian nationals, by international experts such as Physicians for Human Rights, the Mukwege Foundation, 𝗬𝗵𝗲 Foundation, different specific technical experts on medical care, medical legal documentation, and other topics that come forward within the course. And last year, we launched it in Ukraine in an in-person high-level event together with the High School of Public Governance, who is our main partner for continuing education programs in Ukraine. And since then, I won't have the exact figures, but indeed hundreds of users have already accessed the course in Ukraine via the High School of Public Governance. Later on in that year, we also launched it together with the Prosecutor General Office. At least 300 incoming staff to the Prosecutor General Office have taken it already by the end of December. Since this year, we have been rolling it out internationally as well, and this digital launch is part of that initiative. We hope for the course to become really standard training material available also within the global community of practice working on sexual violence and working in contexts affected by conflict. Within the course are 4 modules. It is self-paced, and the overall aim of the course is to really ensure that every type of professional, be them grassroots to specialists, they have the same baseline knowledge of what are the legal and policy definitions of conflict-related sexual violence, how they can know and identify cases and survivors of conflict-related sexual violence, what is survivor-centered and holistic care, what is a trauma-informed approach, why is it important for all professionals, not only psychosocial care professionals, and how all types of professionals can really ensure that they are also caring for themselves, minimizing their risks of stress, minimizing the risk of compassion fatigue so that they can continue doing this work in a trauma-informed way. Katrien and Julia mentioned that we co-created the course, and I think that's really a key part of our approach whenever we develop training and training courses. This is now the 3rd time we've developed a large-scale training course, and it's always a very participatory process where we bring together multi-sectoral professionals and experts, and this is really part of how we end up with a comprehensive and a holistic product. The course itself is self-paced. The 4 modules, the first are defining and recognizing conflict-related sexual violence. The second on what is survivor-centered and holistic care, including a reference to the 𝗬𝗲 holistic care model, this one-stop center approach that the Mukwege Foundation is inspired by. The information in the first module on defining and recognizing conflict-related sexual violence comes from evidence-based documents, but also from our guidebook on conflict-related sexual violence and states' legal and policy obligations to prevent and respond. Trauma-informed care is the 3rd module, and caring for care providers. Persons who access the course you can take it at your own pace. You will be required to complete the assessment at the end of each course, module rather, to be able to access a certificate at the end. And we really encourage users to take the entire course, the 4 modules, rather than pulling out one at a time. I think it's an interesting also part of our advocacy for ensuring that all professionals, be them humanitarian workers, police officers, prosecutors, civil servants, also see themselves and the role that they play in ensuring survivor-centered and holistic care. I will also say that though the course was developed firstly for the Ukrainian context, which is also why we launched it there last year, we now have it available in 4 languages. It will also be available in a 5th language, and I hope also in Spanish in the coming years. And that this express request that came to us from the Ukrainian state is also something we see globally. Across the globe, even though conflict-related sexual violence and survivor-centered and holistic approaches are really buzzwords of the day, and I think as a community of practice, we accept the importance of these terms. In reality, many humanitarians, frontline workers, professionals who find themselves not working on conflict-related sexual violence as a policy issue have no immediate understanding of what that means. What is conflict-related sexual violence, and why is it important for them as a professional to be aware of the distinction without discriminating against other survivors? How can they adopt specific sensitivities in their work? So this is why we developed it. It is available on Kaya. You will be able to see a slide coming up where you'll be able to download it. It is also available on Ukrainian platforms, the High School of Public Governance website, and the Prosecutors Training Center of Ukraine website. But I will also just flag that the course is not public. It is only accessible via those links. So those who are here today, you'll have a unique opportunity to access the course. And we've also placed it on our website, but you will not find it on the Kaya public catalog. If you are interested in hosting the course or learning more about the Mukwege Foundation Learning Program, please contact us at learning@mukwegefoundation.org. That's it. Thank you.
Thank you, Dominique, for walking us through a bit more the reasons, the rationale, and the content of the course. And just to echo what Dominique said, please, at the mukwegefoundation.org resources page, you find a link to the survivor-centered holistic response to conflict-related sexual violence course that's hosted by Kaya. You do need to register on Kaya to be able to access and take the course, and we encourage you to do so and not be taken away by that registration process. So, as I mentioned in the beginning, we are very happy today to not present 1 but 2 tools developed by the Mukwege Foundation. And now we're ready to share the second one that will focus on survivor-centered approaches. And I'm very happy to invite 𝗧𝗵𝗲. As I said in the introduction, she's a SEMA member living in Kenya, and she's here today with us to both share the challenges and her lived experience of not seeing the survivor-centered principles into practice and what the difference is if they are put into practice. 𝗧𝗵𝗲, the floor is yours.
Thank you very much. Am I audible? I hope I'm audible.
Yes, you are.
Thank you very much. It's always a pleasure to associate with the Mukwege Foundation. I call it my mother organization. And it's a pleasure always to associate because I'm also a SEMA member and I'm a proud SEMA member. Allow me to introduce myself. I'm 𝗧𝗵𝗲 from Kenya, and I'm a survivor from our post-election violence of 2007-2008, and by extension conceived and had a child from that violation, which helped me, which was the reason why we initiated the Grace Agenda. Grace Agenda was, please excuse me, just disconnect something. Thank you. Grace Agenda was able to, we initiated it as a response to the post-election violence together with other survivors. What was interesting in the very first place was that we were guinea pigs and we were specimens because there was a lot of transitional justice work around the country at that time. And it enabled us to go in front of very many platforms and to be seen, to be heard, to be spoken to be spoken at through various forums. And what was interesting was that they perceived us as guinea pigs. They perceived us as specimens in the sexual violence experience. However well-meaning it was very undignified, it was very degrading, it was very debasing, it was very demeaning. And it is said that one will not remember the words one has, the stinging words that one has said, but one will very well remember how you made them feel. So the sharing of experience was at large a very traumatizing experience during that time. And we seem to be validating civil society organizations at the cost of our own dignity. And so we decided, how about we get together and do this on our own, and we do it on our own terms. And that's how we first designed what today is Grace Agenda's mandate. And our mandate includes self-agency specifically. Why self-agency? Because self-agency, you can speak how you want, the way you want, whether it is audio, whether it is visual. It also depends on the age. Very many survivors who have got very big children also don't want to be seen, and at times also don't want to be heard in a certain kind of way. So the self-agency enables you to share your story the way that is most appropriate. We also, one of our other mandates is advocacy for reparations, which is a key agenda because reparations for sexual violence are not just like reparations they're different from reparations of forced and forced disappearances, of extrajudicial killings. They're very unique because they talk about your personal bodily integrity. So we find the uniqueness there, and we advocate for reparations for sexual violence specifically, and then memorialization. We advocate that no single story of any survivor should ever be left untold, but it should be said in the way that is most useful to them. So what happens? My presentation is actually going to be anchored in real life experiences that show when you don't use use survivor-centered approaches, what usually happens. First of all, it establishes dependency and a very unrealistic demand. It also creates a sort of entitlement to survivors. They get used to things being done for them, and the organization speaking for them, so they don't develop a mind of their own, and they lean a lot on institutions and organizations. But then thereafter, it turns out that they start feeling also a sense of entitlement, that they're using our data for this, they're using our data, they got money because of this program, so you must do this for us, you must do this for that. So there's a sense of entitlement that comes with them. It's also very extractive when you don't utilize them, and survivors can sense when you're just being extractive, that you just come to them for information, and then you just you proceed on from there. This is another reason why it causes so much survivor fatigue, because you feel used, and it also triggers, and it harms further, and it's not trauma informed at all, and leads to survivor self-blame when you do not use survivor-centered approaches. Survivors are also able to recognize when interventions are not relevant or not perceived to be meaningful because of a previous experience, because they know that you really just come to get information from them, or you just want to do something just to fulfill a certain purpose or to fulfill a certain activity, and then move on from there, not thinking about the impact that you have left in their lives, in the lives of their families and communities. And then when you do not use survivor-centered approaches, there's no sustainability of interventions. There is really no sustainability because it is just based on the institution, and there's no uptake from the survivors themselves. And it also reduces dignity because it says you're unable to plan for yourself. And the organization employs very undignified methods of engaging with survivors because they do not know what matters and what does not matter, because they've not engaged with the survivor. It develops mistrust, especially when it comes to government and other civil society organizations, because we get a sense of just simply based on the extractive nature of mining data from them. It also increases stigma, which leads to less reporting of conflict-related sexual violence. And then the focus on implementing the programs, and it's designed around conference table. When you design things around the conference table, most likely you will not have a touch of what happens really on the ground, and most likely it will be challenged on the ground, either through the environment or through some logistic intervention when you do not utilize a survivor-centered approach. And then it removes agency, and it focuses on the vulnerability of the survivor. When you remove the agency of the survivor and make them feel that they are vulnerable, by not consulting them at every step, it focuses on their vulnerability. And so that means that you're exploiting them, and that is not human rights based at all. Therefore, not utilizing survivor-centered approaches often leads to failed interventions. It leads to re-traumatization. It leads to lack of accountability. It also becomes too bureaucratic because it has been designed around the conference table. It re-traumatizes, and it also increases the culture of impunity. So what exactly is a survivor-centered approach? And I'm giving you this from my personal experience and from working with survivors, and also as being a member part of the Summer Network. Allow me just to scroll down a little bit. I'm conscious of my time, so please kindly bear with me. So this survivor-centered approach, according to how we designed it, was that the inclusion of survivors and their voices from conception to design to implementation of any intervention. It is not making them sit in a room and then ticking a box and saying that, well, that was inclusion and count that as inclusion. It is not. It is the listening to their voices, and that their voices and their sentiments are evident in documents, are evident in policies, and are evident in policies and programs concerning them. So what it does when survivor-centered approaches are utilized, first of all, it strengthens and restores lost dignity. It empowers the survivor, giving them voice and agency, encouraging them to actively participate in their own healing process. Why is this important? This might just sound like an ordinary quip, that they're allowed to participate in their own healing process. But when healing literally determines the value of life, because if they are not healed, it will affect their mental health. When their mental health is affected, that will directly influence the quality of life that they and their children will be participating in. So that's why it is very important to utilize. And what else does it do? It fosters support in the trust in the supporting systems. For example, when the Summer Network was growing and being strengthened, and we were becoming part of it, it was really a consultative process at very many levels. When you consult, consultation dignifies a process. It really does dignify the process. So it does not mean that you're extracting information from us or that you just really want to fulfill organizational mandate, but that you really want to your focus is on healing, your focus is on the survivor, and it is centralized on the survivor and the healing of the survivor. And it also fosters survivor self-esteem, well-being, and acceptance. And that is the value for life of utilizing survivor-centered approaches. As a SEMA member, and drawing from my own membership experience, one of the first things is that it fosters solidarity. And I invite anybody who might be present to please go to YouTube and watch our memorial video, go to our virtual memorial, which is on the Mukwege Foundation website, and see our song that says when we sang about solidarity. Because when we sang about solidarity, that's the theme that came out in consultation with many of the survivors, because based on the setup, I won't go into it right now based on the time, but I want to let you know that when the SEMA members meet together, there's an air of expectation, and there are themes that come out based on the experiences, based on the expectations, based on what it is they want to do, based on the prevailing atmosphere globally also. And the word that came out was solidarity, and that we developed a song based on that and on the songs that were there. So what does solidarity do? It reaffirms the equity, the equality, and the humanity. This is done through the exchange programs, through inter-country survival organizations, because the SEMA membership is based on country organizations. So we exchange as inter-country activities, inter-country knowledge, inter-survivor linkages. We refer each other to places. We refer each other to organizations. We do exchange programs. We do exchange notes. We refer colleagues. We endorse each other. We consult and build consensus on issues. And this is what has brought about something that we've utilized the concept more so when it comes to co-creation, because every program that has been designed, and even more so like even the Survivor Center, the online course, you have co-created the course with the survivor, which means that there was high consultation. So it enables the utilization of survivor-centered approaches, which means the inclusion from conception to design to the implementation. So this ensures ownership and continuity, which is often called monitoring and evaluation, or AKA monitoring and evaluation, but it also ensures sustainability. So the first port of call after safety and security is the restoration process, which is the entry point for survivor-centered approaches. This is what the Mukwege Foundation has been fostering all these years. What are the key challenges in the accountability for donors and partners? The key challenges in the accountability processes is that donors and partners want results based on their concepts of survivor-centeredness at that time. Concepts like transport reimbursements, honoring and dignifying time spent on initiatives, not pretense based on their vulnerability, grassroots level challenges, those pose a real threat to the sustainability of programs. So you can either choose to have a happy donor and a traumatized survivor, or a resilient survivor and a tolerant donor who engages it has jumped. A tolerant donor who engages with survivors from the very beginning, making them aware of the practicality of the intended initiatives. This has helped partner organizations to appreciate the expertise that survivors bring to the table. Their experiences are the expertise that they bring, and because they know they've got the direct contact with the ground and the direct linkages with the ground, so they will be able to share with you what is happening on the ground. Just a quick case scenario is recently when we were given some money to implement a certain project, we were given a partner agency to support us, to help us in our accountability. But what happened was now we had to go through the processes of the organization for us to get the resources that were for the program. So we were unable to plan until the hosting organization or the accounting organization was through with their accounting with their processes. So they made us jump through hoops. You must, for example, you must have three quotations, and you're having a community engagement. 3 quotations, and it's within a community. At times that is not practically possible. And many of these small organizations, when somebody's providing you with tea, or providing you with refreshments, or providing you with a field or a venue, at times it becomes not practical to start requesting organizations. So those are just some of the challenges. I do not want to share the others. I had 1 or 2 other case scenarios, but I would also want to share another scenario. And an international organization partners with a local survivor-led NGO to break the silence around the conflict-related sexual violence. Without proper consultation, it launches a global media campaign using quotes, images, and footage from survivors. Some are taken from earlier private interviews that the survivor had engaged in. So the local NGO and survivors were not involved in shaping the content or the messaging. As the campaign gains visibility, survivors face stigma and backlash in their communities. The NGO's trust and safety are compromised, and no follow-up support or accountability is provided by the international partner. So those are some of that's just a case scenario in which there was no consultation because you were not cognizant of the aftermath of some of these of some of the actions. It becomes difficult for you to implement something properly or to get proper fruits, or you're not considerate of the backlash thereafter, that the life and the security of both the involved the local partner together with the survivors are at risk simply because you did not consult them. You did not know that this community it's very cultural. They're still very patriarchal. That their life, it might impact the other children in the family negatively, the siblings negatively, your own family negatively. So those are just some of the considerations. In conclusion, I am cognizant of my time. I hope I've not created an unrealistic picture and an unachievable aspiration. There is hope and there is guidance from the practical guide that we're launching today, which will provide organizations with experience based on guidance drawing from the lessons learned. 10 years of working with survivors, that says something. Congratulations, Mukwege Foundation, for a job well done. Congratulations, 𝗬𝗲 Network, who have participated together with other survivors. Long live Mukwege Foundation. Long live Dr. Mukwege. I thank you all.
Thank you so much, Jackie, and thank you for your very strong engagement in the past years through 𝗬𝗲 in different international platforms. And thank you for sharing today why survivor-centered approaches are crucial to any support that any of us in this call are wanting to do, and also pointing out that if it's not done in close consultation with survivors, it can even have a negative impact and effect. So thanks, Jackie. And now I want to share with you all a bit more on the practical guide on the approach that with a clear aim to help us all and you all to find ways to actually better apply the survivor-centered approach. And I'm very happy, 𝗂𝗵𝗲 𝗣𝗶𝗴𝗶, that you're here with us today. 𝗂𝗵𝗲 is the co-founder and co-director of IMPACT, a center against human trafficking and sexual violence in conflict. And we're very happy 𝗂𝗵𝗲 worked with us in developing the guide. So 𝗂𝗵𝗲, over to you.
Thank you, Katrien and team. I think you can hear me, right? Yes. So thank you for allowing for me to say a few words about how the practical guide was created, a little bit about the methodology behind the guide. And of course, the methodology is really closely linked with the very reason why this guide was to be created in the first place, namely to help actors working with survivors, such as NGOs, care providers, UN agency, governments, donors, to understand how to use a survivor-centered approach in practice. So in terms of the methodology, the guide came about through desktop research by analyzing relevant resources on survivor-centered approaches, including literature reports and relevant guidelines, which you can also find in the reports. And this also included an extensive desk review reflecting the 10 years of the Mukwege Foundation's programming and engagement with survivors. Second, it also included additional data collection, which was comprising first-hand input through, for one, key informant interviews with Mukwege Foundation staff. Second, focus group discussions with 2 national survivor networks from Ukraine, one from Ukraine and one from the Central African Republic. 3, also a survey filled in by survivors from the 𝗧𝗵𝗲 global network. And 4, also one-on-one interviews with several of these survivors who also agreed to speak to me in person and who had participated in the survey. And this data collection was really very helpful in establishing what a survivor-centered approach entails or should not entail, seen from both the survivors and the actors working in the field. It also shaped the lessons learned, case scenarios and best practices that you can find in the practical guides. So while there are general sections in the guide setting out what survivor-centered actually means and what the core principles are, that should guide also the engagement with survivors, such as what to do, what to avoid. There are also sections for different types of actors working with survivors. And this section is really the heart of the guide, offering concrete advice and examples to support the application of survivor-centered principles in day-to-day practice. And 𝗂𝗵𝗲 𝗵𝗲 will tell you more about the contents of the guide in a minute. What I would like to say that was once drafted, but also every 2 weeks while working on the guide. The guide was carefully also reviewed, including by the Mukwege Foundation staff and survivors, to ensure that the guide truly reflects survivor voices and can be used effectively by actors working in the field. So, this is really in short the background to the methodology. And before I give the floor to 𝗂𝗵𝗲, I wish to sincerely thank the Mukwege team also that they gave me the opportunity to work on this guide in close collaboration with them, in particular 𝗂𝗵𝗲, Clarisse, Maria, Dominique and Katrien, and also of course all the other staff members of the Mukwege Foundation who were willing to share with me their thoughts on the survivor-centered approach. And last but certainly not least, all the survivors who participated and cooperated in this journey by either filling in the survey, participating in the focus group discussions or the one-on-one talks. This guide is really yours. So thank you once more. And 𝗂𝗵𝗲, I will give you the floor now. Thank you.
Thanks a lot, 𝗂𝗵𝗲. Before giving the floor to 𝗂𝗵𝗲, I just want to mention that at the end, so in say 10-15 minutes, we will have opportunity for the participants to ask questions. So if you already have questions or if questions pop up during the rest of the presentations, please add them to the chat function of the webinar and we will then come back to you. 𝗂𝗵𝗲, over to you. And thanks, 𝗂𝗵𝗲.
Thank you all. I will give you a very quick presentation on the guide itself. The best way to discovering the guide is just to go through it, which you'll have an opportunity to do after this webinar, but maybe just walking you through some of the key section could be helpful. So this is what I'll be attempting to do in the next 5 minutes. Next slide, please, Lucy. Why was the guide created? I think this was already mentioned by Jacqueline, who was super well articulated on the risk of not applying a survivor-centered approach on the lives of the survivors of conflict-related sexual violence. We know the importance of applying this approach, yet we see that this is quite inconsistent in practice. So what we've tried to do here is really to stay as concrete as possible, to give practical tips and guidance to different sorts of actors to make the guide easy to navigate. And it's really anchored in the Mukwege Foundation experience of working with survivors over the last 10 years. So it's not meant to be exhaustive, but rather really practical. Next slides, please. So what can you find in this guide? It's divided into 4 sections. The first one, introducing the survivor-centered approach, provides a definition and explain why it matters. And then section 2 really focuses on some of the key principles. Those are the principles that we all know that are at the heart of do no harm in humanitarian practice, but also in gender-based violence case management in general. We go over all of these 6 key principles that you can see in the slide, why they matters, and really looking at the do's and the don'ts, including what you should be saying and what you should avoid to say to survivors. Then section 3 is really the heart of the guide. This section really offers concrete advice and example based on, again, the work of the Mukwege Foundation and discussions with survivors. The first subsection is about nothing about us without us and how to involve survivors in programming, how to recognize that they're experts in their own lives, in their own rights, and that they should be at the heart of everything that organizations do and design. And this is for basically anyone working with survivors. Then the second subsection is for care provider, and it's a lot more about survivor-centered care principles and guidance. Third section is about organizations that are inviting survivors to events to ensure that they can contribute to survivor-led advocacy. And the last section is for donors, because I think we all know that one of the key challenges of implementing a survivor-centered approach is also resources and having the necessary budget to do so. Each section gathers some lessons learned, a case scenario with some survivor-centered tips that comes from the survivors that were consulted as part of the guide, and a best practice example. The last section summarizes all of the main takeaways and offer recommendations on how to effectively use a guide implemented as part of your organization. Next slide, please. So I just will very quickly show you what it can look like. So here is an extract from section 3. Which is again the bulk of the guide. So putting principles into practice. This subsection is about supporting survivor-led advocacy, which is something that the Mukwege Foundation has done quite a bit while supporting 𝗬𝗵𝗲 as a global network of survivors, but also national survivor networks in different countries around the world. What you can see in the screen here is one of the 5 key lessons learned that we shared in the guide. Here, it's about using creative platforms for advocacy and how this can amplify survivors' voices while supporting healing. So, for example, using art, music, poetry, storytelling, how this can be a way to for survivors' voices to be amplified while, for example, protecting their identity, their confidentiality, and also while contributing to their healing and being part of mental health and psychosocial support, for example. Other lessons learned in these sections of how important it is to set clear expectations before inviting survivors to an event and to lead advocacy, but also the importance of recognizing that survivors are experts in their own rights, etc. So again, I'll invite you to explore the guide later on. Next slide, please. Under the lessons learned, you'll find case scenarios. So here is an example of a scenario where an international organization invites a survivor-led organization to break the silence around CRSV. Yet you see that they don't protect the confidentiality of survivors. So I think this is something that happens fairly often. It's never done with a bad intent. I think Jacqueline actually just mentioned this quite extensively during her presentation. But this is a case scenario, and then you'll have a series of 10 different tips coming from survivors directly of what organizations could have do to avoid this type of situation. There's also some best practice example there of how survivors can be involved in advocacy based on the experience of the Mukwege Foundation. This is just a little introduction of the guide of one specific section. The guide itself is around 50 pages. It's illustrated. For now, it's only available in English, but we will be working on a French version in the coming months. This is where you can find it currently. It's on our website in resources. There's also a version available for phone use that is also available on the website at the moment. We hope it's going to be helpful in your work. The Mukwege Foundation is also available to help you roll it out in your organization. Thank you.
Thank you very much, Appeline, for walking us through the guide. And again, I can only say I hope the presentation, but particularly the guide, will be helpful in ensuring that survivor-centered approaches don't remain a mantra, but actually lead to better, more relevant, more trauma-informed programming. Before giving you the floor for questions, I just want to very quickly share some of the other knowledge resources developed and available on the Mukwege Foundation website. One is, and it's on the 𝗧𝗵𝗲 website. 𝗧𝗵𝗲 is also Jackie quite elaborately talked about it. It's the global movement by victim survivors to fight conflict-related sexual violence. And they developed what we call the 𝗧𝗵𝗲 Virtual Memorial, which is basically an online museum of many art, photos, film, voices, poems, songs. You can find the song Jackie mentioned, Solidarity, on this website. So please visit the museum on the 𝗧𝗵𝗲network.org website. Another very important knowledge tool is the legal guidebook on state obligations for conflict-related sexual violence, which you can find on the endcrsv.org website. It's part of the Mukwege Foundation's Red Line initiative, And it really sets out all international legal obligations related to prevention, response, accountability, reparations in human rights law, humanitarian law, and UN Security Council and other resolutions. And last but not least, the first Mukwege Foundation, a knowledge resource we developed, the Holistic Care Handbook, currently available in English, but also French, Ukrainian, Arabic, Spanish, and Tigrinya. So again, all to be found on this one, mukwegefoundation.org. Now we have a few minutes and time for the Q&A. So I hope my colleague, let me see. Please feel free to add questions. I see one question, and I think it's an important one, and I want to ask Dominique and Apolline to refer to it. It's, can these guides be used also for survivors, women who are victims of violence outside of conflict and war situations? So maybe, Dominique, can I give you the floor for the tool, you know, the guide, the training, and then Apolline on the best practice.
Yeah. Well, I'll start with saying that survivors are not only women, so the tools are not women specific. They can be used for men, boys, children. The course itself is not the same as a guide. The course is a course on response to CRSV. So the first two modules in particular are really about conflict-related sexual violence and ways of defining and responding to it. The second two modules are broad. And I think those principles are broadly applicable. Firstly, on trauma-informed care. And of course, there is a specific reference to how to apply trauma-informed care and psychosocial tools and approaches to working with survivors of conflict-related sexual violence. But those tools and approaches can also be used for other victims and survivors of conflict. And then the last module is for everyone, which is how can a care provider in whatever circumstance better take care of themselves. So yes or no, I think it's particularly for the course worth diving into it and taking it and seeing what lessons might be drawn out for other survivors of conflict-related sexual violence or other uses.
Thanks very much, Dominique. Apolline, same your reflection on the best approach guide.
Yeah, absolutely. The guide can be used for all victims of gender-based violence. It is not specific to conflict-related sexual violence. The first section of the guide that really dives into the definition is also based on protocol and standards that we see overall in GBV case management and humanitarian principles in general. The Mukwege Foundation supports SEMA and national survivor networks that tends to focus on conflict-related sexual violence, but even within these networks, we know that there are survivors of other forms of gender-based violence, and they've also contributed to this resource. So it is helpful for any organizations working on gender-based violence, I would say.
Thanks. Thanks, Apolline and Dominique. I think there's not any more questions. So if you have a question, please type it in the chat. Otherwise,
maybe
sorry,
I jump
Dominique.
back in.
Yeah?
Yeah, thanks, Katrine. Just one last thought on that same question, which is, I guess, important to also say that the language of survivor-centered approach or one-stop center or holistic are not new, right? Like, I think they've become recently much more de jour because they've been integrated into policy, which for us is watershed. That UN security resolutions now talk about survivor-centered and multi-sectoral and holistic approaches, and they affirm survivors' rights to do so. But I would just want to remind everyone in the room that those approaches are not only for survivors of sexual violence. I think they're mentioned in policy for example, children affected by conflict, survivors of HIV, survivors of torture. So I think we our focus is on conflict-related sexual violence, but of course these terms are for everyone. And I think we don't own them as such, you know, but we have driven forward the practice when it comes to CRSV. Just to complete the answer, that I think these tools specifically, we gear them towards CRSV, but of course I think anyone working on any field with a vulnerable person should be considering a holistic and a survivor-centered approach, person-centered, patient-centered, however you make that a reality in your own work.
Yeah, no, thanks, Dominique. I can only echo and reinforce that. No, to see that trauma-informed survivor-centered is not owned by the Mukwege Foundation. It's not owned by survivors of CRSV only, but it's an approach that should be guiding any engagement with survivors. I see, Apolline, you're answering 𝗧𝗵𝗲. Hey, 𝗧𝗵𝗲. Good, you're part of the call. Looking at the time, I will just round up. Let me thank all the presenters. So thank you very much, Jackie. Thank you, Annemarie, Julia, Dominique, Apolline, for sharing the creation, the methodologies and the content of these tools. And of course, we hope that these tools will contribute, that survivor-centered approaches are not just abstract ideals, but they're practical, learnable, and as you all have shared with us today, they're transformative when applied with genuine commitment and accountability. The resources are now public and they're yours to use, and I encourage each of you to explore them, share them within your teams and networks, and bring them into your work. As shared, the digital course is available on the Kaya platform, and you can access it through the Mukwege Foundation website. It's available in English, French, Ukrainian, Burmese, and the practical guide is available on our website. We want them and we hope they reach as many people as possible. If there's one message I hope you take away today is this: survivor-centered practice, it's not a checkbox. It's a continuous commitment, and these resources are here to support you in that journey. We will be following up with all links, etc. If you have any questions, please, we can be reached at any of these, through any of these channels and the email address. So thank you for your time, your engagement, your dedication to the work, and only together we can make survivor-centered response not just an ambition, but the norm. Thank you very much.